Actually, 21st century, first our topics is the pharmaceutical quality, right? So 21st century, the ooze of the 21st century discovers first the regulatory uncertainty that inhibits the innovations and the improvement. Second is the process are held in the state of control. The term is a very important state of control, but little knowledge available about why and how they manage to attain the status. Third is a enormous data collection, but little analysis or effort towards the conversion of the data to the meaningful informations of the knowledge. And fourth is the materials are well characterized, process factors are not well understood. So this is our ooze of the 21st century in the pharmaceutical sector or pharmaceutical quality. But now, recently, in the 21st century, when the quality epidemic swept the globe, there is a different definition of the quality. So at the time, pharmaceutical sector selected the most famous scientist or philosopher or statistician, Zuran's philosophy, that is the fitness for the use. ICH guidelines, international harmonizations for the conference guidelines, expands this. It's the suitability of the either of the drug substance or drug products for its intended use. That's guidelines according to the ICH guidelines Q64 specification. Now the quality now is revised. The modern definition of the quality is inversely proportional to the variability. Now we just come into the statistics, variability, the unknown factor in the product process and the system. And quality improvement is defined as a reduction in the variability of process and products. Recently, the modern technologies, the quality is revised as the definitions. That is the quality is a degree. To century now, the different pack process analytical technologies and others ICH expert working groups define as a desired state of that affairs to be the attained, both for the industry and the agency. So now, first we have to think about in the 21st century, in terms of the quality, it's a desired state. 20th century, it's prescribed as a state of control. Now it has converted the philosophy to the desired state of the product process system. Now I just explain briefly what is the desired state. Desired state means is a barrier to the continuous improvement to be least or removed. Number two, creates the enabling environment to promote the innovations by removing the regulatory fear or regulatory uncertainty. Number three, utilizing the science and risks-based approach to the oversight. So, modern concept in the pharmaceutical sector is a risk management system, already included in the pharmaceutical product system. Also, the flexible and less burdensome approach for well understood process. Okay, and also sustaining and improve the product quality and performance achieved and assured by design of effective and efficient manufacturing process. Also the specific and also the desired state under the desired state. I am telling you, focusing that. Specification based on the parameters that truly impact the product quality to the mechanics, understanding the how formulation and process factor impact the product performance. So these are all the desired state. So we hope, and globally we hope, the current scenario, the all pharmaceutical community have been choosing to move towards that desired state of the 21st century from the state of control of the 20th century. That is the beauty of the pharmaceutical quality. As a recent trend, it goes. Okay. Now I'm sharing. Just hold. Just have you seen statistical quality control? Okay. So before starting the slide, just I'll share the concept. Actually, it is the statistical quality control is a tools. to reduce the variability because of the different many quality problems. Okay, so if we have the collected the sufficient data from this variation, also we can tell in the terms of probability what is the most likely to occur. So we can take the suitable action to try to maintain the improve the acceptability of the output. So first we have to understand what is the variability. So variability is a very unknown factors. Different types of the variability in the statics in the pharmaceutical process. Uh, mm, Two types: a spatial and assignable cause and chance or common cause. So variability varies directly with the patient to the with risks to the patients and inversely with the process understanding. We automatically reduce the variability and the consequent risks to the patient. Actually, our process to maintain the quality main goal risk factor of the patients. So if you produce the output of the process with the acceptable quality, then we can reduce the risk factor to the patients. So higher the variability, the lower will be the quality. If you lower your variability, higher will be the quality, resulting the less OOS specification out of specification and lower will be the risk factor to the patient. That's our goal in the pharmaceutical sector, and that's why everybody are going towards the satisfied quality. So quality. Next, assignable cost. What is the assignable cost? Variability may be due to the two types, may be due to the causing of the two types, spatial and assignable cost, and second is the chance or common cost. The assignable cost makes a process very unstable, makes a process means hop about the target and resulting in the frequent OS situation and placing the patient at the high risk. Okay, and chance cost makes a process or disperse or spread around the target of your specification. Eliminating or controlling requires the high level of the process characterization and optimization. Okay, understood? My word understood, everybody, student? Hello. Next. So I am telling two types: inherent cause or common cause, and assignable cause or spatial cause.